You're listening to The Bird Bath. Welcome back to The Bird Bath. Each week we scrape the surface of the news you need to know, and bonjour. Yeah, that's right, people. This week I am coming to you from France, or France, the home of baguettes and butter and cheese and all delicious things. But you all know the news never sleeps. And this week we're even more lucky and happy and special and everything to have a really late breaking story. We've got the chance to sit down with the CEO of an incredible company, but let's get into it. So our top story this week is a huge funding round for a Series B with Gallant. Gallant has raised an $18 million Series B. It's led by Digitalis Ventures, which many of you know. They've backed some incredible companies in our space. The other partners behind this round were their original partner, Bold Capital and Hill Creek Partners, as well as someone coming to the vet space from a really successful portfolio in the human medicine side of things, of stem cell research and a lot of other great funding. But I knew that I would probably butcher the science and not give this the full due that it deserves. So we have a very, very special guest this week. We have the CEO of Gallant, Linda Black, here with us. Linda, thank you for joining us.
Thank you. So happy to be here.
Well, first off, congratulations. I know bringing a funding round together is never something that's easy, and especially when you're doing it on the cutting edge of science. It's probably a little easier sometimes to do it when you're just sitting there, cranking out recurrent revenue on a software platform. But when you're actually breaking science and changing the way people look at things, it's even harder. But I just wanted to hear from you. What is the process? Where are you guys right now? What's going on at Gallant, and where's this funding going to take you?
Sure. It's definitely not for the faint of heart to raise a round of financing. And we're just so grateful for current investors and having NovaQuest as a partner now on board with us. It really rounds out our syndicate and gives us the capital to really move the business forward towards this conditional approval for our first product and also into commercialization of that.
So for those of us, and I think pretty much every person that listens to the show is smarter than me, but let's dumb it down just for me. What on its just most basic level is Gallant bringing to the market? I know you guys do a lot of things in stem cell. You're taking on FCGS and a lot of other things. What's Gallant really tackling with these stem cells?
Sure. So the biggest differentiator between stem cells and other therapies are that they are disease modifying. So they're really meant to help pets not just feel better, but actually get better. The therapies don't just treat symptoms, they are actually changing the underlying biology of the pet. And so they're different than all other classes of therapies that are in the marketplace right now. So we're really bringing a new way to do stem cell therapy, a way that's scalable, a way that every veterinarian can have it in their clinic. We call it ready to use or off the shelf. One day, every veterinarian will have these products and they'll be part of the standard of care. This first product is for refractory feline gingiva stomatitis, which is a deadly disease in cats. And the big thing about it is we're hoping this is going to be the first FDA approval of an off-the-shelf or ready-to-use stem cell therapy in our industry. So we're really bringing a whole new category of care to veterinary medicine. But even more importantly is this lays the regulatory groundwork, a roadmap, so to speak, for our pipeline of products. Our products are all from the uterus. So it's a platform technology of uterine-derived stem cells, and we have 5 products in that pipeline right now that are all working their way through the FDA approval process. So the first product is special for many reasons.
Yeah, I can only imagine the work ahead of you guys, but that sounds incredible. And I thought when I was reading a little bit more about the partners, NovaQuest obviously really stuck out. It seems like just recently, a company that they backed in the human side of things just received one of the first FDA labeled approval for human medicine. Is that right?
That is correct. So Mesoblast is a company that for quite a while has been working on the exact same technology using a bone marrow-derived stem cells. And their product Ryoncil was approved by the FDA for graft versus host disease in children.
Oh, wow. Well, so all of this is incredible. I know you guys have a lot of work ahead of you, and I hope that this $18 million of funding helps that continue on. I know the FDA is probably going to try and grab a nice big chunk of it as much as they can, but it's always great to see new and unique processes coming into the space. Cannot wait to see where this goes for you guys. I'm going to have you back when you get your FDA approval. I'm not saying if, I'm saying when, because you're going to do it. And I cannot wait to see all of the incredible things you do. So thank you so much for coming on the show and breaking this down for everyone.
Thanks so much. I loved being here with you.
If you want to learn more about Gallant, be sure to check out their website. Go on to any of the many platforms. I know that Linda's done some incredible interviews. They've broken down a lot of these things, and make sure you follow along with their journey. I think it's going to be something that a lot of us are going to not only see benefits for our animals and our pets and the way people practice medicine, but I think this is going to continue carrying on and growing into the human side of things with partners and other FDA approval. So really, really excited to see that. And thank you again to Linda for joining us. Our next story is two kind of connected ones. We hit on some cool FDA approvals, but I wanted to talk a little bit about something else the FDA has up their sleeves, which is two stories that the AVMA highlighted. The AVMA highlighted risks of two different types of drugs that are falling outside of the regulatory scope with the FDA. One is involving CBD PrEP products, and the other is involving a sedative showing up in human drug supply. First up, the FDA has issued warning letters to three companies, Bailey's Wellness, Holista, and House of Alchemy, for selling unapproved CBD products for animals. I know we've hit on this a few times, and I think it's kind of this difficult area where there's the growth of CBD products is faster than a lot of the regulators can keep up with. So for these companies, there's oils, chews, pellets, and they're all marketed as treatments for anxiety, pain, and even cancer. Some were even sold for the use in food-producing animal, which really kind of brings about a big concern about drug residue in milk and meats and all of those things. The products that they're selling are non-FDA approved, and so there's a question around the efficacy of them. I'm not one to jump into it. I'm in Texas, where we were just moments away from a law banning the THC and other CBD products that a lot of people are using here in the state. And it was saved by a last minute veto. And let me stay away from politics as much as I can here. But the big thing here is that three companies are just getting on a spot with the FDA where they're going to need to make some adjustments and some changes to how they're bringing their products to the market. They've got 15 days to respond before the FDA considers stronger actions like seizures or injunctions. Meanwhile, another drug that's in many veterinary clinics is raising alarms on the human front. Public health officials have found medetomidine, which is an FDA-approved sedative for dogs and cats, is being used as an adulterant in street drugs like fentanyl and heroin, which to call something an adulterant for fentanyl seems like quite the strong word. It's not something that's super isolated, though. There have been overdoses in Chicago, Philadelphia, Pittsburgh, and in many cases, the reversal drug that people are using is not working. It's not something that people are expecting to find this drug in the street. Some patients are only responding to dexmedetomidine, which is, again, another related veterinary drug. The DEA and the CDC are watching it really closely, and they're also talking about what we saw for the xylazine crisis. And the big difference here, though, is the strength of what is getting put in these drugs. This isn't just animal health news, but it's something that, as you're in the veterinary clinic, it's extremely important to be on top of those regulated drugs and be on top of the controlled substance logs. People are taking this medicine that is important and vital for the care of our animals and putting it into things that are killing people. So not to be a downer here, but it's definitely important. It's something that is medicines and drugs being used outside of their prescribed use or their approved context. So definitely check into what you're doing here. If you're using any of these CBD products as well, look into where the case studies are showing efficacy, where you're finding the sourcing from them, and make sure that everything that you're putting into your patient's body, or if it's yourself that you're putting it into your own body, is exactly what you think is there. Now, I thought coming off of drug use, it might be fun to go into something a little more fun. There's a new survey that shows classroom pets enhance the learning experience for students. So there was a nationwide survey by Pets in the Classroom grant program, and they collected insights from over 1,300 US and Canadian teachers, and the results are even better than I thought they would be. I remember as a kid, I had fish, and there weren't a lot of pets in my home, but I do remember in the science classroom we had chinchillas, and they ran around and they had these tubes running everywhere, and it was incredible. It was such a wonderful experience to be around these smaller animals in that learning environment and understand the care and the things that go into it. And the Pets in the Classroom grant program shows a lot of this. The survey of these 1,300 classrooms, 99% of teachers say classroom pets have had a positive impact in their students. 94% said that they reduce anxiety, they improve the empathy and compassion of their students. 97% say that they found an increase in the responsibility of their students. There's fewer disciplinary actions, higher attendance, and also boosted academic performance. One of the teachers was quoted saying, "Having a classroom pet has brought our class together in ways I never imagined. They're learning science, responsibility, and compassion, all through caring for tiny living creatures." I just think this is awesome. It's something that I didn't even know about the Pets in the Classroom grant program, and to see the impact that it's had is awesome. So I'm really glad to be able to bring the news to you here. The program was established by the Pet Care Trust to help teachers introduce classroom pets into their learning environment. And since 2010, the program has issued over 263,000 grants and impacted more than 10.5 million students. The reason why this is news, beyond just the great news around it, starting today, pre-K through 12th grade teachers in the US and Canada can apply for funding to support a new or existing classroom pet. I think I remember, and we might all remember, that the kid that has to bring it home or the parent that needs to bring food in for the pet. And so this is a grant that allows teachers to be able to offer this compassion and this care in the classroom without coming out of pocket in their already strapped pockets to begin with. Grants are available throughout the school year, so teachers are encouraged to do their research and apply when they're ready to bring on this additional responsibility. I'm going to put the link in the bio. And you can check it out as well through Pets in the Classroom's website. Again, really cool program and something that I think a lot of teachers and educators should take part of. So if you know one, tell them to apply now. Another thing people can apply themselves to is a new study that's investigating burnout among relief veterinarians. Serenity Vet, which is a relief veterinary platform, has teamed up with Talkatoo and Dr. Ivan Zach from Galaxy Vets, who's done many burnout surveys, to launch what they're calling the first ever dedicated study on burnout among relief veterinarians. If you're wondering why they're specifically targeting relief veterinarians, it's because relief veterinarians are growing really quickly. 6% of the workforce in 2024 did relief work, and now it's over 9% in 2025. But the thing is that a lot of these people that are going into it are still suffering from the burnout that they saw in traditional practice. It's one of those things that a lot of people thought going into relief work would eliminate or reduce that burnout structure, but it's actually shown an increase. And so the survey is designed to try and understand exactly what are the causes of this and how providers like Serenity Vet can assist in helping make sure that the relief doctors that are working with them are getting the best service and care and compassion that's necessary. So along with this, the new study wants to dig deeper. They're looking at factors like scheduling flexibility, financial stress, administrative load, and overall well-being. They're going to be using a Stanford Professional Fulfillment Index as a base. And there's also questions around specific things that are driving relief work. It's a 10-minute anonymous survey. It's open now, and you can go right on to the link in the bio to check it out. It's going to be something I think is going to be pretty cool. I'm going to obviously update you when the results come in, so check it out now. Every survey that's been done by this team that puts together burnout surveys for the past few years has been super actionable and extremely, extremely important for our industry. So if you're a relief doctor, check this out. And if you work with relief doctors, be sure to stay tuned for what the survey results tell us about working with these types of partners. Finally, there is some big teeth in bears' mouths. That's right. Yeah, that's science. That's news. A brown bear in northern Minnesota has made what they're calling dental history after receiving a full metal crown that's the first of its kind. You gotta look up a picture of this thing. It looks like Jaws that you'd expect from one of the Bond films. This is a big honking metal tooth, and it was awesome. Lake Superior Zoo in Duluth announced that the bear named Tundra needed the dental procedure after fracturing his tooth back in 2023. Although he underwent a successful root canal, following the injury, he re-injured it later, and the huge crown, which the zoo is calling the world's largest veterinary crown, was created to help protect Tundra's tooth for the rest of his life. The procedure was led by Dr. Grace Brown with the support from the team at Creature Crowns and the entire zoo staff. The zoo put out a statement saying, "We're incredibly proud of the collaboration between Minnesota veterinary dental specialist, Creature Crowns, IM3, and our zoo team. All of Tundra's care was donated, and we couldn't be more grateful." So if you're in the Duluth area, go check out Tundra, see if you can get a glimpse of that big old crown, because I'm gonna be honest, I'd love to see that thing. It was awesome. The pictures were cool. And it's definitely one of those stories where you love to hear about this sort of unusual care that we don't see traditionally in companion animals. If you want more on these and other stories, join us by subscribing to our Substack. There's a link in the bio. And don't miss out on any episodes by subscribing and rating the show. For The Bird Bath, I'm Ryan Leach. See you next week. Au revoir.